Is your dog or cat slowing down? Maybe the cat's not jumping up on the counter like they used to. Maybe the dog isn't going on as long of walks. They are more reluctant to go on walks. These are all really common things I hear from our senior animals as they come in for annual care. Mobility is a big factor for a lot of families. And there's a lot we can do to help with mobility. Starting from diagnostics. Typically, if we're having trouble getting up and moving around, you want to start with a physical exam to understand maybe which body part is affected. From there, we typically want to do x-rays or radiographs to look at the bony structures of the body and see if we see any signs of arthritis or perhaps something else that's going on that's limiting their mobility. From there, if we get our diagnosis of arthritis, which is really common in dogs and cats, there's a lot of things that we can do to help. More traditional medications would be something like NSAIDs, non-steroidal anti-inflammatory drugs that help to decrease pain and inflammation, and these are a great option for many animals. Typically, we want to do a little blood work if we're going to start using NSAIDs because it can put a little bit of extra pressure on important organs like the kidney and the liver. Then there's a whole class of newer medications that have come out to help us with our arthritis. These are medications like Librella for dogs or Solencia for cats. They act a little bit differently than NSAIDs. They actually serve as a monoclonal antibody against nerve growth factor, which nerve growth factor is known to sensitize the nerves and joints to pain. And by going in and binding up that extra nerve growth factor, it can help keep dogs and cats more comfortable. I have a few patients that used to not be able to go to the beach anymore because their mobility was really limiting. We got them started on Librella and I started seeing them at the beach more frequently. So it's been a really great tool for a lot of animals. Then we have a whole host of other adjunctive kind of therapies that we can consider. One of those being laser therapy, which was really helpful for my own personal dog when she was going through arthritis. We'd come in once a week, get her laser therapy. She'd act like a puppy the next day, and then we'd bring her in the next week for some more laser therapy, and it was really helpful in her senior age. Another treatment option for mobility is joint supplement. Favorites of mine are things like Cosequin and Dasequin. I also love omega-3 fish oil, so it can be really helpful, and we're finding out more information about how it decreases inflammation within the body. For my own personal dog, I had a really hard time getting her to take supplements on a regular basis, and so I elected for a dietary option called JD or Joint Diet. It's a Hills brand diet that has all of that good glucosamine, chondroitin, omega-3 fatty acids in it to help support their bone health. If your dog or cat is suffering with mobility, don't just accept that they're slowing down. There may be a lot of things that we can do to help improve their golden years.